Good morning, Jasmine.
Good morning.
Looks like we've got a busy day ahead of us, don't we? How was the retreat yesterday?
Oh, it was phenomenal. They actually had sessions on team building, time management, physician support after patient safety incidences, so it was fun.
Oh, that's good. It's nice that the program's able to build several of those things into the retreat.
I agree.
So first on the agenda for today, though, is a family meeting. It's with our 3-month-old patient's family to discuss some of the poor neurological outcomes we expect with the complicated meningitis. Have you had the opportunity to lead a family meeting before?
I have led a few. I find them quite challenging, actually.
What parts of the meeting do you find particularly challenging?
Sometimes I'm just not sure how to introduce prognosis.
Yeah, I can see how that can be difficult. A phrase that I find helpful sometimes is to ask the family permission to talk about their future with the child's illness. That might be something you want to try.
Sure, I can lead the meeting with that.
Yeah, well, how about we go in together? I'll let you lead the meeting and I will observe, and then after we can sit down and have a conversation with some feedback and coaching around how it went for you.
Okay, that'd be super helpful.
Okay, well, let's go.
All right.
So Jasmine, how was that for you leading the family meeting?
I actually thought it went really well. There were some times when I didn't exactly know what to say, so that's when I deferred to you to fill in the blanks.
Okay, well, I do want to talk about some of those tricky parts, but first I'll invite you to just share with me what you think went well.
Yeah, so I started off with introductions, and I felt that set the stage for me to ask them what they knew about the patient's condition, and then that phrase you had mentioned was really helpful in introducing prognosis.
Definitely. So I think you did a really nice job about introducing everybody. You did a nice job of breaking the information into small pieces and using non-medical jargon. I think that was all really well done. And I do appreciate that you used that phrase about prognosis, and I'm glad that it went and it worked for you. Tell me a bit about the parts that you found tricky.
Yeah, so I started going through the MRI findings specifically related to the complications of meningitis and how that insinuates a poor or negative neurological outcome. And then I felt the need to continue to give some more details of the MRI, but at some points I just felt like they didn't understand what I was saying because they kept probing me to do more testing, and I felt that was frustrating.
Yeah, it can be really frustrating and challenging when you feel like what you're sharing isn't aligning with the patient and the family. And I have to say, I also noticed that you were giving additional details about the MRI findings when that was happening. Tell me a bit about what your intent was in doing that.
I mean, I felt they were quite quiet and uncomfortable, so I thought more details and giving more information would actually help them comprehend what was going on.
Okay, I think one of the things that I noticed when you shared the prognosis was how tearful and upset the patient's mother got. What do you think of that observation?
I mean, I just had so much information to get through. I didn't want to be distracted by the emotional piece.
I can see how you may have pursued that line, but I think the emotion is also something important that we need to address. Do you have any thoughts around what you could have said to address that at the time?
I'm not sure.
Yeah, responding to emotion can be quite challenging, actually. I think it's difficult for patients and families when they hear poor prognosis, and it can be very upsetting and saddening for them, actually. Some things that I found helpful are to pause after you've shared information about poor prognosis, give the family a chance to just digest what they've heard, maybe acknowledge that this is difficult for them, and just allow them to share how they might be experiencing some of what you've shared with them. So if that was something you were going to do, any ideas around how you would phrase that or set that up?
Well, I could have acknowledged that the mom was sad and say, I understand that you're sad. It's always difficult to hear information like this. Something along those lines.
Yeah, I think that would all be quite reasonable. Now that we've talked a little bit about this, any ideas for any goals you might want to set for yourself for future family meetings?
Well, I guess if that's your feedback, one of my goals would be to learn how to acknowledge and respond to emotions such as sadness, anger, frustration in the clinical setting.
That sounds great. What resources do you think can help you with that?
Well, Dr. Sandu, if you have any articles or online videos I could watch, that would be great. And then perhaps I could observe you leading a family meeting this week.
Definitely, I can certainly send you some resources, and I'll make a point of showing you how I'm responding to emotions with different patient and family encounters we have this week. Anything you think might get in the way of you achieving this goal?
Yeah, I mean, there's so much, like, we have so many patients to see, so much to read in the evenings. I just don't know if I have the time.
Yeah, I can appreciate how that's challenging. Who are you working with next week? Might they be able to help keep you on track?
I'm working with Dr. Peters, so I could inform him that this is one of my goals and see if he can observe me in clinical encounters.
That sounds great. And then beyond this period of time, anybody else who you can work with or anything else you can think of to help keep you on track with this goal longer term?
Actually, I'm meeting with my faculty advisor next week, so that could be a point person to kind of make sure I'm working on this goal and achieving it.
Yeah, that sounds excellent. How will you know you've achieved this goal, Jasmine?
I think ultimately I'll just need to ask my preceptors that I'm working with, as well as other allied health professionals such as social work and nursing, to observe me in clinical settings and see from their perspective if I'm achieving this goal.
That sounds great. Good. Well, thanks for sharing and your goals with me and for talking about them together with me to set you up for the future.
Of course.
Should we go see the next patient?
Yes, we shall.